Good morning, everybody. It's Dr. Galvin with a post-ER shift update. I worked this past 3 nights in a row. This is my last night. It's been busy here at the hospital. Hospital's been busy. Luckily, we have not been holding as many admissions as we have been in the preceding weeks. We actually had enough room for everybody. So when people got admitted to the hospital last night, they, for the most part, got admitted to the floor. I only had, I think, 4 or 5 people that actually kind of stuck in the emergency department, meaning that they're technically admitted to the hospital, but they never left the emergency department room that they were in. We've had days in the last couple of weeks where we've had, upwards of 40 people who are boarded in the emergency department because there's no beds. We usually, in normal times, we would try to transfer people. If we don't have beds here, try to transfer to another hospital, but every hospital is dealing with the same problem. There aren't beds anywhere. And I think I've alluded to it before. It's a concern because this time of year is not really the busiest time of year. A month from now, though, when the winter hits, is when things get really, really busy. And if we're overwhelmed now, there's a lot of concern amongst myself and my colleagues that things could get really, really bad come winter time. Regardless, as usual, for those of you who don't know, my name is Jeffrey Galvin. I'm a board-certified emergency medicine physician. I work part-time in the emergency department here outside of Charlotte, North Carolina. I also run a functional medicine high-end concierge clinic in Charlotte as well. We've been doing updates about the virus and other things since it all started. I usually start with the numbers, and we have 37.5 million cases worldwide. We're almost to 1.1 million deaths worldwide in the U.S., 7.86 million cases, 218,000 deaths. My state of North Carolina, 231,000 cases and 3,791 deaths. Interestingly, India looks like it may soon surpass the U.S. in terms of actual cases. I think they're over 7 million, and they're going up by about 75,000 a day. The U.S. is going up by about 50,000 a day. So it looks like India may pass us for being the number one in terms of an individual country with cases. But as a percentage, India is something like 4 times the size of the U.S. Population-wise. So the percentage is higher still in the U.S. The emergency medicine is a funny specialty, and we take care of everything and anything. And you never really know what's going to come in, but it does seem that sometimes you have sort of clusters of things. And I don't, one night it might be one thing, one night it might be some other thing. On Friday night here, we had 4 or 5 rollover motor vehicle accidents, and that's a lot. Rollover, to actually roll a car over is sort of a big deal, and to have 4 or 5 of them all in one night is interesting. Last night was definitely COVID night. We saw, I think, 9 or 10 pretty sick COVID patients that needed to be admitted. Some of whom were quite sick. Sometimes we have nights. I was in one room for 2 hours. It wasn't a COVID patient, but it was someone who just really was doing their very best to die for about 2 hours, and we ultimately were able to kind of get the problem under control. But it's hard if you've got responsible for 50 beds in an emergency department and you can't do anything for 2 hours. The place can get backed up. Luckily, I've got great support. I had a PA, Stephanie, who was working with me last night, who's awesome, and she kind of had my back. And so while I was stuck in that room, she made sure that people got taken care of. And so shout out to Stephanie because she's awesome. Couple things I want to talk about. One is that there's some talk in England about doing a human challenge trial. Now, what is that? When we've got 11 vaccines right now that are in phase 3 trials, meaning that they're being tested on generally 30,000 people. Now, when a vaccine's in a stage 3 trial, you give it to about 30,000 people to see if it works. Now, what you do is you give it to those 30,000 people, and then you let them go live their lives. And you figure that, just based on the amount of virus that's out there, a certain number of them are going to get exposed, and then you can compare that to the regular population. But you're not exposing 30,000 people to the virus. What you're doing is you're letting sort of the population-based dynamic take care. It's generally felt to be unethical to expose people intentionally to a pathogen. But there's some talk in England about using human challenge trials, which is where you take healthy people, you give them a vaccine, and then you intentionally expose them. So you you get much better data because you know that they've actually been exposed, and you can actually expose 100% of the people that get the vaccine. Now, there's a lot of ethical issues with that. Suppose the vaccine causes a bad side effect, or it doesn't work and someone gets really, really sick. But there are people volunteering to do it. I think a lot of the big vaccine manufacturers don't want to be involved in human challenge trials because of those ethical issues and concerns. But they are talking about potentially doing something like that in England, and that would be a way of assessing some of these other vaccine candidates in a much quicker way than just sort of recruiting 30,000 people, which is hard to do, and then waiting to see if they get exposed or not. The last thing I want to talk about is COVID brain fog, because in my clinic, in part because of the videos and people know that I know a little bit about the virus, we've been seeing more and more people that are coming to us with post-COVID symptoms, people from all over the country, really. And one of the most common things we're seeing is this COVID brain fog, meaning that people have had COVID and then their brains just aren't working that well. They're having episodes of confusion, of memory loss, inability to pick out words, cognitive issues, diminished focus. I've got a patient who is in New York, who's young and a student in nursing school, had COVID and all of a sudden getting Fs and everything, about to fail out. And we started working with her and are doing a number of things, including looking at nutrition, looking at sleep and stress, doing actual neurocognitive testing, actually using some biohacking things like racetams and nootropics and some other things, and have got her back passing her classes, and she got an A on one test and a B on another test. But it's treatable, but it's very interesting. Why is it that people are getting these long-term problems? Well, it may be in part related to the immune response. Maybe something with the body's immune response to the virus is causing some kind of short-term, at least, damage to the brain and causing these cognitive difficulties. The other thought is that since we know that COVID is a vascular disease as well, it may be vascular dysfunction or endovascular dysfunction, and it's causing inflammation of blood vessels that may be causing some of these symptoms. It seems like a lot of the symptoms are similar to what we see in dementia, things like Alzheimer's. And we have a protocol that we use that's based on the work that Dale Bredesen has done, that we've had very good success treating Alzheimer's in the clinic. And we're using a lot of those same techniques for COVID, and they do seem to be working, which is interesting. And we think that a lot of times, there are different types of dementia, and some of them are related to inflammation, some of them are related to toxins. Some of them are related to autoimmune disorders, and some of them are related to metabolic dysregulation. And we think that maybe, we're still learning, but maybe this COVID brain fog may have something to do with it. So if you happen to know somebody that's dealing with that, or you yourself are dealing with it, try to find a doctor that's familiar with this problem, because, like I said, we've had good success recognizing it and treating it, but if you don't treat it, it seems like it slowly gets better, but it can take months and months and months, and it can be very, very disruptive, especially if you're a fairly highly performing person and all of a sudden you feel like you've developed Alzheimer's related to this infection. It can be very disheartening. I'm gonna kill it there because I'm tired. It's been a long weekend, and I'm gonna go home and get some sleep. I'll be back later in the week with more videos. If you find this useful, please follow us on Facebook, like us on Facebook, subscribe to our YouTube channel. We'll be bringing more content to you soon. If you have specific questions that you'd like me to cover in a video, throw it in the comments, especially on Facebook. We do have somebody looking at those. I look at them as well, but I have some help looking through there, and we'll try to answer those questions. We are planning on doing a couple more collaborative broadcasts with Q&As with other physicians. Probably bring Dr. Hogenkamp back. I think in first week of November we're going to do that, possibly with another physician. So if you have questions, post those. Everybody stay safe as usual. Wash your hands, wear your masks, look out for yourselves, look out for your family, look out for everybody else. We are going to get through this. Treat other people like you want to be treated. So, even if you have an issue, with that mask, remember you're wearing it to protect others, not to protect yourself. And, it's a minor little thing that we do. And if we all do it, we're all going to be better off. If we just think about the other guy a little bit. I'm going to call it a night there. Sweet dreams, everybody. I will talk to you soon. Bye.